You're with, I'm sorry?
Care Improvement Plus.
Oh, okay.
Oops. How am I gonna have this where it doesn't?
Well, I suppose I could at least introduce you, right?
Right.
Uh,
We could do that.
Today we have Delilah Vasquez. Delilah put on a program a couple weeks ago that I attended in Flower Mound. It was an excellent program, and she has graciously accepted our invitation to put on a program today. So, and it's going to be about the Medicare Workshop and changes to Medicare. So let's.
Well, thank you first of all for having me here. It's a pleasure. And like Mr. Phillips said, my name is Dalia Vasquez. I am a Community Outreach Manager for Care Improvement Plus, and we're owned by United Healthcare. And this program was put together. It's called National Medicare Education Week, and this was to bring out educations to the community, to individuals who are aging in, or they're new to Medicare, or they have loved ones, they're caregivers, taking care of a person who's going to be 65 or they're 65. And this program can be pretty complex and confusing. So on the time frame that you see there, September 15th and the 22nd, what we did, we went nationwide, all over, and had these workshops just to bring out the word and educate the people to prepare themselves for the annual enrollment period coming in October. Okay, and that's what I'm going to present to you. Choices, who's eligible, and just kind of get familiar with Medicare. And I'd like to recognize United Healthcare, AARP, Enterprise Finance, and the National Family Caregiver Association. Those were our supporters. So let's get started. So understanding Medicare options. We're going to cover how to be eligible, coverage options, when to enroll, and the next steps and resources. So the first step you do is eligibility. Consumers need to know when they're eligible for the Medicare. And original Medicare consists of Part A and B. And the guidelines, you do have to be 65 years or older. And if you're under, it could be under circumstances of disabilities or other special situations. You must be a U.S. citizen or a legal resident who lives in the United States. If you're a resident, you must have at least 5 years, consecutive years in the U.S. working. Now, something to know about the age 65 rule. If you're already collecting Social Security, you must wait until you're 65. You must be 65 yourself, not your spouse. And even if you're not collecting Social Security yet, you're eligible at age 65. So the choices, once you're on Medicare, you have Part A, you have B, the Part C, the Part D, and also choices of medical supplement, Medicare supplements. So the choices when you become eligible for Medicare, your first step is original Medicare A and B. And this is a government program that you're entitled to. On your option 2 to your left is your Medicare supplements. That's an option. You do have to have Medicare A and B and or Part D, which is your prescriptions. That's one option when you become eligible for Medicare. And this is if you need more coverage other than what Medicare covers. Hello. On the option 2 is your Medicare Advantage plans. That's a Part C. And these combines A and B coverage of the original Medicare. You have additional benefits, and most of these plans consist of the prescription drug plans. And these all are offered by private companies. And these are your options as well. Keep in mind, these are options. So let's cover a little bit of what Part A and B covers under the original Medicare. The Part A is your hospital costs and skilled nursing services after a hospital stay, plus some other skilled care. So that's your Part A. And as you see down here on the list, you can see it's inpatient hospital care, mental health care, home health, hospice, and some blood transfusion. The Part B is your doctor's office visits and other medical services that do not require a hospital stay. And there's doctor's visits, here's your doctor's visits, your outpatient hospitals, which are minor surgeries, outpatient surgeries, ambulance, outpatient medical health, mental health, laboratory services, your dual medical equipment, which is your wheelchairs, oxygen, canes, etc., and outpatient physical, occupational, and speech language therapy, and some preventive care as well. These services and supplies must be medically needed. So, to keep in mind the cost on Part A. Now, Part A, most people don't pay a monthly premium. They only pay your deductible, which is first the $1,156. This is for 2012. Or a hospital stay less than 60 days. The enrollment is easy. You can't be turned down because of any medical history pre-existing. And then your coverage, the long hospitalizations can be expensive, very expensive per day. If you stay more than 60 days, it requires daily co-pays. And you can go to any qualified hospital in the U.S. that accepts new Medicare patients. Hospitals outside the USA is usually not covered. So if you're visiting outside the US, usually it's not covered for Medicare. You will not find all of this briefings on the book. This is something for you just to take and follow back, so you don't have to look at the book. On the Part B, the cost, there is no minimum out-of-pocket. For coinsurance, in general, you pay 20%. So original Medicare pays 80%. And the consumer's responsibility is at 20% of any Medicare approved cost. If you wait to join after your entitlement enrollment period, you may have to pay a higher cost, a higher premium cost, because you did not enroll when you initially were supposed to, and that's called a penalty. The enrollment is easy. Your medical history pre-existing doesn't matter, there's no income involved, and the coverage for Part B works the same throughout the U.S. You can get it anywhere you are at, generally outside the U.S. Again, there's not a cover. You can receive care from any participating physician who accepts new Medicare patients, and preventive care is limited. This is the Part B. So what doesn't it cover? It doesn't cover your Part A deductibles and coinsurance premiums, and the Part B deductibles and coinsurance premiums. The Part B excess charges, amount billed over what Medicare agrees to pay, that doesn't cover. And also your prescription drug plan known as the Part D is not covered. Feel free to ask any questions as we're going along. Now, let's talk a little bit about your options. Advantage plans. What is Medicare Advantage? These are single plans offered by private companies that combines coverage for original Medicare, Part A and B. So all these Advantage plans all regulated to provide those services, A and B, and sometimes prescription drug coverage, which is your Part D. Okay, all the benefits of Part A except hospice care is covered under the Advantage plans, which is hospital stay, skilled nursing facilities, and home health. All the benefits of Part B is also covered under the Advantage plans: doctor's visits, outpatient care, screenings and shots, your flu shots, etc., and lab tests. Prescription drug coverage are included on most of these Advantage plans, but not all. So you really have to check on that when you're looking into an Advantage plan. Is your first question would be, does your plan include the Part D prescription option? Now, additional benefits. Some of these Advantage plans will bundle additional benefits. That's some service that is not covered under the original Medicare. And this consists like eye care, hearing, wellness services, and nurse lines. And remember, there are several Advantage plans out there that give different benefit options. So that's another thing that you would want to ask if you're seeking into, if you're inquiring on a specific Advantage plan. what are the extra benefits that you will provide me? And they're all different. Another thing to keep in mind is the cost. Plan premiums and terms, they can change from year to year. Okay, your premiums and the terms of that can change year to year. Every year, you know there's a change. Even in our own Medicare services, there's always a change. So it also falls under the Advantage plans. Your enrollment, your eligibility for enrollment is not affected again by your health or financial status. The special rules for the end-stage renal disease, one known as ESRD, those are different. In some plans, it's a disclosure, but you do have to ask. The coverage, convenience of a single plan, it's very convenient when you have an Advantage plan because it's like a whole package in one. It will include, of course, your prescription drug plans. Most of these plans you receive coverage in your service area, not unless it's an emergency. If you're out of your service area and you fall, that's an emergency, so they cannot decline you for that service. For some plans, you're required to see doctors and hospitals that are not included on the plan's networks. And we're going to talk about that and break it down so you can understand what that means. Many plans may offer additional benefits that's not covered through Medicare, like dental, vision, hearing, and preventive care services. Here are the 5 types of these Advantage plans that you need to be aware of. And it says Plan C because all the Advantage plans are well known as the Part C to the Medicare, A, B, D, and C. So these are your Advantage plans to C. They coordinate care plans. They are known as health maintenance organizations, which are HMO plans. You have preferred provider organizations, PPO plans. And then you have your special needs, and they're called SNP. When you hear the word SNP, they're referring to special needs plans. Other plans available are private fee-for-service and medical savings account plans. These are all the Advantage plans Part C's that are available for consumers. Now let's break it down with the HMO. What is an HMO plan? Well, these plans, it stands for the Health Management Organizations, first place. I know there's a lot of acronyms. And the Medicare Advantage plans is a network of physicians, hospitals, and other care professionals. Those are your HMOs. When they tell you we're HMOs, so you know you're going to get a network, you're going to get a booklet, they're going to tell you these are your hospitals, physicians, and specialists that you need to stay within. Generally, you must get routine care from an approved network of doctors and hospitals. That's why they give you that booklet. And your primary care physician that oversees your care must refer you to a specialist when required. So that's why you need to pick a family physician. So if you need a specialist, that physician will refer you out under the HMO plans. Now the care is received, if it's received outside your network, it's not going to be covered, not unless it's an emergency, because you've gone out of their network. Many plans include prescription drug plan and additional benefits. So it's something that you would have to ask that particular plan, what are your extra benefits? Now the PPO plans, these are the preferred provider organizations. The hospital costs, doctors, outpatient care is all in one plan. And these plans give you more freedom of going out and choosing. You're not required into a network. There's no referrals needed to see a specialist. So you have the liberty of choosing your own physicians and hospitals. And you can use doctors and hospitals outside the network. However, you may receive a higher cost premium benefit. And you can also, it also includes the drug prescriptions and added benefits. Now the PPOs, how they work, usually, of course, when you go to a physician, they do have to be a Medicare provider, contracted with Medicare, but they do not have to be in a contract. As long as they accept, they say, well, I don't want to be in a contract, but I will see the member. As long as they're willing to file a bill to these plans, the PPO, you're okay. And there's where it might be a little higher cost. Now, special needs plans. These are coordinated plans. These are for individuals with special needs. They're more complex. They have chronic conditions, they require more needs of medical care. So it also falls for individuals who are institutionals, they reside in a nursing home. Special needs are also for dual, what we call people who are both Medicare and Medicaid, and they qualify because they're low income, so they're called duals because they have both Medicare and Medicaid, so they also fall under the special needs. And chronic conditions, and that's for individuals who have a chronic condition such as diabetes, congestive heart failure, chronic lung disease. There's a whole bunch of them, of chronic. Yes,
I
ma'am?
have a question.
Yes.
Does it have a age limit on that SNP?
As long as you're 65 or as long as you're receiving Medicare A and B. If you're a Medicare consumer and you have one of these conditions, you fall under the special needs. You can look for a special needs plan to provide you that care. Okay? So it's not about income, it's not about how old I am, it's all if you have Medicare A and B, that's your qualification. Also, these plans focus on helping members receive well care coordinated. If they can coordinate their care, it gives them a better understanding of what they're dealing with. So because of the complexity of it, the plans really focus on these individuals to educate them so they can live a healthier lifestyle. Because once they understand what they're going through, then they know how to deal with their chronic condition and stay out of the doctors as often or hospitals. So they really focus on coordinating their care. It also specialized benefits and services. They specialize on care teams. Some of these PPOs, special needs plans, create a team that will focus on that individual because of their chronic condition. And also it enhances education and communication, which is a big thing, is the communication and the education. So these are your special needs plans that you might want to be aware. Now, my last workshop that I was at, I had a family and they had never heard of special needs plans, but they've been in existence since 2003 when the Modernized Act was signed, and President Obama signed for these special needs plans to come aboard, and they're still in existence. And there's a lot of people on these plans because it does help them. So who can join? That was your question. You can join a Medicare special needs if you have Medicare A and B, if you live in the service area, the plans area, and you meet one of the following requirements. If you reside in a nursing home, which is institutional, if you're receiving both Medicare and Medicaid, considered dual, and you have a chronic condition such as diabetes, heart failure, COPD, etc. Those are the ones that can join these plans. Now, keep in mind, when it comes to the chronic condition, it does have to be verified by a physician. The plan will require verification. It does not consist of borderline diabetes. That's not, in fact, being chronic, because you could, if you took care of yourself, you could step and not be a diabetic. So borderline is not a chronic condition. And a lot of people think it is, but it's not. The doctor has to say, well, she's diabetic, but she's got it under control. Okay, but the doctor said you're a diabetic. If you go off your diet and you don't take care of yourself, then you're back into taking that diabetic insulin, etc. Then you're still a diabetic. So it is a chronic. It never goes away. It can go dormant, but it can't go away. A little bit more on special needs. It offers health care services through a single health plan. So you don't need extra health plans. These single plans will provide all your needs that you need. They'll help you manage your different services and providers. It kind of groups them in so they can talk to each other. It can make it easier for you to follow doctor's orders related to diet and medication, and also helps members obtain assistance from the community programs and coordinate Medicare and Medicaid services appropriately. So a lot of our folks, that's their problem, is that they don't know how to communicate and where to get this information. So these plans, that's why they're called special needs, and they focus a lot on these individuals to help them understand and get all this care met. Services and benefits, they must cover all medically necessary and preventive services covered under the parts A, B, and D. A, hospital. B, doctors. D, prescriptions. And they must provide additional services to support the members' health needs, such as the nursing support, and there would be a 24-hour, 7-day week access to their nursing. Also transportation, that's another need for special needs. One big thing is they don't have a way to get to the doctor. So we can provide that transportation that avoids them canceling their appointment because they don't have a ride. Also medication counseling, that's a biggie, because that's one of the things they don't, they get too many medications, and some of it could be duplications, or it could be over-medicated, under-medicated, so the counseling it's a big play on this coordination. Chronic condition special needs plans, Medicare Advantage plans are designed to serve people diagnosed with specific chronic conditions, such as diabetes. Features care management programs designed to serve special needs of people with that condition, because it never goes away. So the more you know about it, the better you know how to deal with it. It also offers opportunity to improve care for Medicare beneficiaries with chronic conditions through these improved coordination and continuity of care. So you can actually get someone who's really chronic live a healthy lifestyle by using these services. The dual eligible special needs plans, we said those are individuals who have Medicare and full Medicaid. Well, not necessarily full Medicaid, because Medicaid could be a QMB, SLMB, any of those programs that fall under the Medicare is a dual. They can help people get help from the community and coordinate many other Medicare and Medicaid services. There is a program that helps individuals how to get assistance with their electric bill, their phone bill, and that's the coordination of care for these individuals, because they're low income, they need those extra help. It's a special needs, and a lot of our folks don't know how to reach out and get those benefits. So the coordination care comes in a very good play with these special needs. Joining and switching, eligible beneficiaries may join the special needs plan at any time during the year, throughout the year. It's called qualifying for special election period. These folks who are under a special needs plan, they have chronic, they're dual, can switch and choose and change throughout the whole year. They're not locked in like most people that are on Medicare that don't fall under special needs. They're obligated to only open enrollment. But this group of folks can go out throughout the year. To qualify for this, if you're new to Medicare, you can use this special election, that's an exception, or you're dual, or you've newly been diagnosed with a chronic condition. Then you fall under the special needs. Or if you move from a different state, your plan that you had in a different state or county service area, and your new residence your plan's not there, then you fall under the special election period. So a summary, special needs types. These are type C plans. They include customized plans with chronic conditions with both Medicare and Medicaid, residing in an institution home, which is a nursing home. Also includes the prescription drug plans that provides additional benefits and services to support these needs. Prescription drug plans. There's a lot of them. Okay, these are standalone plans. So an individual can choose a prescription drug plan, and it helps them only with their prescription cost. Okay, their drug cost. It works differently. Medicare A and B, you can only have Part D. You know, some people say, well, I don't need to go into an Advantage plan, I just want a Part D plan because Part A and B is sufficient for me. So just remember that you will get coverage A and B, and what did we say earlier? Medicare pays 80%, 20% is the consumer's responsibility, but the Part D will help you only with your prescription. Okay? It works differently, so you can tell that, and we're going to break it down. You must continue paying your Part B premiums. On all of these plans that we've talked, even an Advantage plan that you sign up, you're still responsible for your Part B premiums, not unless you have qualified for an exception under the Medicaid program. Okay? So the cost to keep in mind, this helps the prescription, we're talking about the drug prescriptions. It helps cost with your prescription drugs. Total of plans can vary significantly. So plan to plan, they offer different costs, different prescription. Catastrophic coverage protects you from very high cost drugs. Your plan benefits includes your premium, deductible, co-pays, and that can change year to year. The enrollment, you must enroll in a Part D coverage. It's not automatic, so it's something you have to do it. If you don't sign up when you're supposed to, then later, 2 or 3 months, you choose to sign up, you're gonna face a penalty for late enrollment. And that's the second line. So avoid this penalty. If you're a consumer into new Medicare, now you're still working, you're still covered under a credible insurance, you're okay. But once you retire and that doesn't exist, then you need to sign up for the Part D. You won't get penalized because you were under a you were covered under a credible insurance. But if you fail to sign up when you're obligated, then you will be penalized. Yes, ma'am?
Is that 1% per month penalty? So if you were 4 months late in signing up, you got a 4%?
Right. And this is a penalty that does not go away. The only time that it will go away, if at one point your income drops to a point where you're eligible for Medicaid, the extra savings program, then it'll uplift that penalty. But that penalty will follow you for the rest of your life. So please, if you work with any consumers aging into Medicare, please highly advise them, we were talking earlier, is sign up for your Part D. Sign up for your Part B as well, because you don't want to face this penalty along the way when you actually need it. And I have seen this a lot. The coverage plan has a list of drugs that it covers. Make sure your drugs are covered before you enroll. Screen them forwards. And then the list of drugs can potentially change every year. So for example, you're on a Medicare A and B, you got a Part D prescription. We're coming into a new year, 2013, it's around the corner. This is the time where you want to look at your plan that you're existing right now to make sure that all your prescriptions are going to be covered for next year. Okay? So that's what it means, make sure that it's covered because it can change year to year. So a little bit about the cost sharing, how it works. The Part D coverage gap, what you need to know. There's the annual deductible. Not all plans have deductibles. You may pay deductibles. You have to pay your deductibles before the initial coverage. The initial coverage stage is during the stage that you pay a flat fee, copay, or a percentage of the drug total cost, coinsurance for each prescription you fill. The plan pays the rest until the total cost is paid by you and the plan. Once it reaches $2,970, then you go into the next step, which is coverage gap stage. That's well known as the donut hole. So during that stage, you're going to pay 47.5% of the total cost on your name brand prescriptions. Remember a few years ago it was 100%. Well, this year is 47.5% of the total cost. And then 79, and that's the name brand prescriptions. 79% is the total cost of your generic drug plans. Once your out-of-pocket cost reaches $4,750, you're moved to the catastrophic coverage. So that's the third stage. And once you're in this stage, you pay a very small copay of Coinsurance each time you fill your prescription. The plan and Medicare will pick up the rest until the end of the year. Okay. Now next year, the 2014, that percentage is going to get higher, where you're going to pay less every year, and they're working it where maybe the